Hello, my name is Dr. George Olstein and I welcome you to my video series. Today's video I want to share with you a clinical case which happens to be about tooth wear and erosion. It's tooth wear and erosion, and I want to share this with you so that you can see what can be achieved these days with modern dentistry. Now with this patient, firstly he's a person that lives overseas and travels to Australia occasionally, so we had to fit in with his travel plans. And thankfully we were able to do that, even though it was a little bit of a challenge. Now, I'd been seeing him for a number of years and had warned him about the tooth erosion and the wear that was going on. Finally, he came around to going ahead with treatment as he could understand the consequences. And if you are not sure about this, please refer to a video I made a little while back that does talk about tooth wear and erosion and its consequences. Now, in this slide, you can see how his teeth are looking. They're pretty badly worn down, particularly towards the back. He does have a chip in the front teeth. With the front four teeth, the upper front four teeth, he wasn't that concerned about the cosmetics or anything like that. And other than that little chip there, he was quite happy with the way they looked. So we concentrated on more of the all the lower teeth, all of the lower teeth, and most of the upper teeth. Now, all of those teeth that I've mentioned needed to be restored by either porcelain crowns or gold crowns. In this next series, this is a side view of how his teeth looked before we started, and you can see the extreme wear that was going on in most of his teeth. In the next slide, this is showing you a mirror image of his lower teeth. So if you can picture that we're standing on top and looking directly down on his lower teeth. You might be able to see, if you look closely, that he does have some crowns towards some of the back teeth, and even those have actually been worn through, and that's some of the black areas you can see showing through on the chewing surface. Now, they were porcelain crowns, and they did have a metal substructure, and his biting force was so extreme that he's worn through the porcelain part and now exposing the underlying metal of the particular crowns. Now here's a slide of the before and after, and it just shows you the results that can be achieved. And there's some beautiful porcelain work that is made by the laboratory that I used, who are really first class. And it's really important to have a laboratory like that who understand all the principles that are involved. Because when you have someone with a lot of wear and tear and erosion, the bite, etc., there's a lot of engineering that needs to go into planning this case. And if you don't have a laboratory that understands this, then you're not going to get the long-term results that I tend to achieve because of all the planning that goes on. Just a quick word about the gold crowns that I've used. Now, these were selected in consultation with the patient because gold doesn't wear, whereas porcelain can actually chip away. And the patient decided that this was better for him in the long run. But it doesn't mean that you have to have gold. A lot of people don't like the look of gold in their mouth, even though it's towards the back of the mouth. These days, we can use zirconia porcelain, which is a very strong porcelain, and it's often termed the white gold. And if you want to use that, then that can be used. As I said, I, at this stage, prefer to use gold, as it has the score on the board, so to speak. Now, if you've enjoyed this presentation and you feel that you are someone that could be in need of this sort of treatment, then I'm more than happy for you if you feel like travelling to my surgery in Paran. This is a suburb about 10 to 15 minutes outside the central business district of Melbourne. We'd be more than happy to evaluate you and assess and see whether our type of dentistry is going to be useful for you. If you would like to get in contact with us, here on the slide you have the contact numbers. You can call us on area code 03 9510 1644, or you can refer to our website and email us on info@olstein.com.au. I hope you've enjoyed the video, and I look forward to possibly meeting you in the future and looking after your dental needs. Thank you once again for watching.